My names are Dr. Uchichukwu Nelson Yejimbe, Chief Consultant Obstetrician and Gynecologist at University of Niger Teaching Hospital, Iyenu, Ogidi, Anambra State, and a former Director of Public Health and Disease Control, Anambra State. I'm speaking on the platform Women Healthcare. This platform can be found in Facebook, YouTube, TikTok, Instagram. The platform is about teaching women's health problems and well-beings and solution to them. Some women think that when they have fibroid, they will not have children anymore. That fibroid does not mean that that woman is barren or sterile. There are solutions to the problem. Uterine fibroid is the commonest tumor of women in reproductive age group. It is found most commonly among the blacks, the Caribbean American, African Americans, the Afro-Caribbeans, more than the Hispanics, Latins, and Asians. It is 3 to 9 times more common in black people than in white or Caucasian people. Fibroid is a benign tumor. Benign means it's non-cancerous. Tumor of the smooth muscle of the womb. It originates in different parts of the womb from certain mutations in the cells of the smooth muscle. Then there are several. The general cause of fibroid is unknown, but there are some risk factors that we know that causes that predispose women to uterine fibroid. I will take time to elaborate on some of them. One, fibroid risk factor is high in women who have no children before. Two, you find it more in women who have two full-time children only. You find it in women who are obese. You find women who have families where fibroid run in their families, especially through the mother and sisters. We have also fibroid is also found to be common in women who use herbal concoctions and botanicals that are unregulated. I also find fibroid to be common in women who are obese. There's lack of physical exercise, activities or exercises, consumption of saturated fats or genetically modified organic foods or roasted foods, consumption of all kinds of factory-produced spices and scoops, food additives and noodles, women who are infertility, women who drink a lot of alcohol, air pollutants and environmental toxins, pesticides, and early menarche, those women who see their period very early in age, and those who have cessation of their menses very late in age, at late menopause. And use of steroids or dioxins in skincare products, and use of long interpregnancy intervals. In other words, women who have pregnancies in between long interval between each pregnancy, like more than 5 years. These are women who are at high risk of uterine fibroid. The risk of uterine fibroid is low in women who are lean, women who indulge in physical exercises, women who smoke, women who use oral contraceptive pills or patches or long-acting reversible contraception or injectable from adult age, and women who eat white meat, namely fish, turkey, chicken, cow skin, intestine, stomachs, and leg meats, and women who started having their babies at young age after marriage, and women who do not drink alcohol or consume factory-produced food additives, spices, genetically modified foods, and animal fats, and in women whose chromosome 12 is not linked to fibroid growth. In other words, they do not have any genetic tendency to produce fibroid. And women who use wig or braid their hair in their native culture without hair relaxers or chemicals, and women who refuse intake of herbal concoctions no matter the pressure, and women who drink potable water in glass cup, green tea, and consume watercress, crucible vegetables, fruits, berries, nuts, or eat what we call Mediterranean diet that is common to the Mediterranean climate and Asian climate. If you combine them, we call them Mediterranean diet. It is nothing but eating a lot of fruits, vegetables, olive oil, things that will not increase either your cholesterol or cause one heart disease or one metabolic problem or the other. And women who practice exclusive breastfeeding. These women I mentioned are women who have low risk to uterine fibroid. Yes, how does someone know that he has uterine fibroid? Some women don't know they have uterine fibroid because most of the fibroid are asymptomatic. They don't produce any symptom. Then for those who have symptoms, it ranges from excessive menstruation to long period of menstruation. And some of them have pressure effects from the fibroid, ranging from pain in the pelvis. Some of them may have urinary frequency, urinating frequently because the fibroid has fallen upon the bladder. Sometimes some of them may complain about constipation because uterine fibroid have fallen into the rectum and blocking the passage of feces. And some of them may have pain during the time they are having menstruation, that is dysmenorrhea. So, and some of them may feel a mass in the lower part, feel something that is hard in the lower part of the abdomen. And most occasionally, they will come to the rise that they have uterine fibroid because of the fact that some of them are married and they start looking for the fruit of the womb. And that will lead them to to the hospital, and they will do scan and they discover that they have uterine fibroid. If you have any of these symptoms that I mentioned, please contact your doctor or health practitioner in a hospital. Don't go about taking concoctions, native concoctions, botanicals that you see advertised on the street or carried everywhere. If you take proper attention to taking care of solution to your problem, you have a very good chance of living a good life rather than waiting very late when it becomes too late for you to see solution to your problem. If you have any health related issue concern women, say it in the comment section. I'll make a video about it. Stay safe and healthy.